Millions could face starvation as coronavirus takes its toll worldwide. That warning from Oxfam. It says hunger caused by the pandemic will kill more people than the virus itself. So who should step in to stop this disaster? This is Inside Story. Hello there and welcome to the programme. I'm Laura Kyle. More people will die this year from hunger caused by the pandemic than from COVID-19. That's according to the charity Oxfam, which says some 121 million more people could face starvation because of reduced aid, mass unemployment and disruption to food production and supplies. It also describes middle-income countries such as India, Brazil and South Africa as emerging epicentres of hunger, with millions of people facing being tipped over the edge by the social and economic effects of the crisis. Well, let's take a closer look at some of the figures in that report. Oxfam says some of the world's poorest countries could see 12,000 extra deaths per day due to hunger before the end of 2020. The charity says this is more than the peak global coronavirus death rate of 10,000 per day in April. The 10 extreme hunger hotspots the report highlights include Afghanistan, Syria and South Sudan, where the charity says the situation is most severe and getting worse. Let's talk about this further with our guests today. And from Madrid, we have Chema Vera, the Executive Director of Oxfam International. From Sana'a, Walid Al-Thujeri, a member of the Yemeni Society for Emergency and Disaster Medicine. And from Cairo, Reem Nada, Regional Communications Officer with the World Food Programme. A very warm welcome to all of you. Chema, if I could start with you, this is a pretty hard-hitting report. How have you reached this number of more people potentially dying from pandemic-related hunger than from the virus itself?
Thank you, and thanks for this space. I mean, we have been doing a combined research using data, some of them actually from the World Food Programme and other from other research centers, with our experience in some of the countries that you have named, both countries that were already affected by hunger massively, because usually conflict countries actually, and new countries that are coming to this hunger virus, as we call it. Finally, we found as a result the figures that you have said, and that show that terrible situation in terms of human suffering because of the coronavirus and because of the hunger virus.
And so just to be clear, this 12,000 figure is on top of the existing daily death toll from hunger. So these are new, potentially preventable deaths.
Of course. I mean, should be all hunger deaths should be prevented, but this adds to the normal toll of death rate because of hunger. And what we are seeing is in those countries that were already massively affected by hunger because of conflict, of climate change, of inequality, of poverty, this builds onto that, is the final line. It means that lines of that farmers are not supported, that markets are disrupted, that food supplies can't reach, that there is massive unemployment, there is no safety nets. So finally, you have millions of people that are facing starvation, as we are saying, 120 million.
Walid, Yemen is one of those countries that's already massively affected by hunger-related deaths. It's been on the brink of famine for years. How has the situation there worsened with coronavirus?
Yes, first of all, let me thank you for the invitation, and let me thank you for focusing on this topic, which really concerned not only me and not only every Yemeni, but every human being in this world who care about humanity and humankind. As you all know, Yemen considered lately from the largest food crisis worldwide. The ongoing conflict in Yemen has created the worst humanitarian crisis in the world. Millions of people have been displaced by fighting to the latest of food. The latest food assessment, which was held by the many working NGOs in Yemen, a report that shows situation in the country is worsening. According to that assessment, which was done in 2018, 20.2 million are at high risk or a threatening shortage of food, which means 76% of the total population are facing life-threatening shortage of food without assistance provided by humanitarian community. As we compare this number, this roughly twice the population of Sweden. This includes people who have been internally displaced, or as we call IDPs. 3 million or more were displaced across 21 governorates, mainly due to the conflict or due to the armed conflicts and not due the disease. This is a general holistic view that I can give you and give all audience.
Wally, just give us an idea, if you can, what it's like to be hungry, because most of us do not know what it's like to be so hungry that we don't know where our next meal is coming from, that we are on the brink of death. What are you seeing there in Yemen?
Yeah, as you know, Yemen depends mostly or 50% on the import. So due to the tight blockade that Yemen faced for more than 5 years by the union of some neighboring countries, the famine in Yemen increased most likely to cover the 3/4 of the whole population. And as I just mentioned, 3 million of IDPs. I attended the humanitarian needs overview, which was held by the OCHA at the end of 2019, that show the Yemen is considered lately from the largest food crisis in the world. Not only food, as well as the clean water, the human rights, the health. I don't know why people lately focused on health, which was already damaged from the beginning. But as we compare to the world, it's 70% of people in Yemen died due to COVID-19 as compared to the world, which is 5%. However, this number is still very low as compared to the famine and to the food shortage that the whole Yemeni are dying from, especially childhood. If you know that
I'm just going to jump in there to bring Reem into the discussion now, if you don't mind, Waleed, because we want to get an idea from you as to why so many people around the world are going so hungry when there is enough food in the world.
Well, yes, there is enough food for the world, in the world for everybody, but not for the poorest, for the hungriest, for the weakest. The problem is that the poor in the world, the hungry in the world, their situation is getting worse and worse and worse. Their only hope is for humanitarian assistance, is for people like us, the World Food Programme, other humanitarian players as well, to step up the game and to actually provide them with what they need urgently now. And we are seeing problems even in the developed world. There are economic problems even for middle class, people who have small businesses. So now we are talking about people who have daily wages. We are talking about displaced people, small-scale farmers. The World Food Programme, the response this year is the biggest in our history. We are talking about providing assistance for 140 million people. That is 40 million more people than the number we had assisted last year.
But how did we get to this point? We're 6 months into this crisis now, into this pandemic. How have we reached this point now where we're looking at this and we're talking about this with these terrible predicted figures?
The countries that are taking it hardest are countries that are not starting from a good position position anyway. You talked about Syria, about Yemen, you talked about South Sudan, Afghanistan, even countries in Africa like Zimbabwe, for example, that's struggling with low foreign currency reserves. So there is no way for these countries to get up and to actually have what they need in the situation that we're living in now. There are disruptions in trade, disruption in supply chains. There's an economic slowdown across the world, even in the developed world. So in these countries, with people who are living on next to nothing, any shock, any little shock would actually throw them off balance. So this is a huge shock for everybody across the globe. And for millions and millions of people, many of them are displaced. Many of them are living in countries that are suffering from conflict. We have also in some countries a toxic combination of conflict, economic meltdown, armed struggle, and drought in other countries. So other shocks related to climate change as well. So this is not something that the poorer communities can deal with.
Okay.
So as much as
Chema,
the
if I want to just then bring it over to Chema to say if these poor countries can't deal with it themselves for all the reasons that Reem have outlined, why not a better global system to catch situations like this, to catch people, to better protect the most vulnerable?
Yes, this is what should happen. I mean, this food crisis over the coronavirus crisis shows that we have a broken food system. And obviously there has to be a very quick response. Actually, we have been raising this issue for months. So you were saying last 6 months, and actually we humanitarian agencies have been raising this hunger crisis and poverty crisis that was coming, that was mounting, and now it's in front of us. So there has to be an urgent, extraordinary humanitarian response, and we are seeing the opposite there. We are not seeing there is a UN appeal of funds, 7.3 billion, that has been covered by donors only in 24%. But actually the food component of that has only been covered by 9%. So we can't expect, and 7.3 seems a huge amount, but if you compare with any bailout of, in the US air companies by 500 billion, it doesn't mean that much when we're talking about humanity. We are also asking for a full cancellation of debt during 2020 for low-income countries. There needs to be fiscal space, and countries can't put money in servicing debt when they can't put money in their health systems or in their food systems and give some cash protection for the most vulnerable in those countries. Obviously, we are joining UN call for a ceasefire, for a global ceasefire. Those countries, as I said, that are facing the heaviest, the most severe hunger crisis are those that are also facing conflict. But finally, we have to tackle the food system as such.
Yes, and I want to get onto that again in a little bit. But first of all, I just want to pick up on this debt cancellation idea. We've got a G20 finance ministers meeting coming up. Are you hopeful that that's going to be on the agenda and it will be accepted?
We're hopeful that it's going to be in the agenda. We have seen some steps precisely on the bilateral debt of the members of the G20. Although they're speaking more about moratorium and not cancellation, it has to be cancelled for this year. If not, you're building more debt for the future. But still, we have to see, and we want to include private debt and multilateral debt. So also debt coming from the IMF and from the World Bank and development banks. This is not still there, and we are asking, and it has to be a full, all the debt cancellation for 2020 as a first step, an urgent step, if we want to face this crisis properly with sufficient resources for government to cope with it.
Walid, Yemen has been the source of many appeals, charitable appeals for aid. What has been the response to the crisis there, the international response?
Yes. As I just mentioned, that Yemen and the whole Yemeni were in a tight blockade and no import, just a little export, no airports, no traveling, no even patient can travel. So, many NGOs were ready to respond to that humanitarian crisis, and they find difficulties here, especially in the north. However, all of the humanitarian community aids do not meet the real requirement that we are here facing in Yemen. We need more cooperation. We need more international aid. We need a serious move toward and really concern about the whole Yemeni who are concerning about tight blockade, about hunger, about already damaged health system. As the world struggle to get the health services that he needs in COVID-19, let us tell you that we are in Yemen struggling to get all that services for the whole year. Thanks for all international NGOs who collaborate and provide many programs here in the north and in the south as well. However, as I told you, and through this program, I want to deliver the message that the real requirements do not meet with what Yemeni needs, as 20 million are facing a really shortage of food, and that's worsening more and more.
Reem, why is the global response to fundraisers like this so poor? Why is the UN only getting 9% of the money it needs to tackle food insecurity?
Because basically there are many domestic priorities for donor countries that they need to tend to. There are economic, as I said, there's an economic downturn or slowdown, if you will, in developed economies, and there's also their own COVID response. And there are people also who lost jobs in donor countries. So for the UN to be able to secure the funds that we need, for example, for the World Food Programme, we are appealing only for until the end of the year for $5 billion. That's massive. We are asking for more money than we had ever asked for because the needs are greater than we had ever seen before. So, of course, in this very difficult donor environment, because they are dealing with their own problems as well, it is a struggle for any humanitarian agency to be able to secure the funds they need. For example, we talked about Yemen. In Yemen, and until the end of the year, the World Food Programme still needs, or in short of, $740 million to be able to provide food for more than 13 million people. 13 million people who almost entirely depend on the food or the food assistance they get from the World Food Programme. So there are people in the world, the 140 million people the World Food Programme is seeking to provide food for, whether that is through actual food boxes, whether that's through transfer food vouchers. They have nothing but us. If they have nothing, and if they don't have us, they have nothing else.
Right. Chema, you mentioned before that COVID-19 has exposed what probably many people already knew was a broken food system. How would one create a new sustainable system if indeed the opportunity does exist here now?
It should be. I mean, it is showing, as you say, all the weaknesses. Obviously, there are a lot of disruptions in the system, in the food chains now, in the supplies, in the routes, but it's showing the underlying tensions and weaknesses. And we have to build a different, a fairer, more robust and more sustainable way of feeding the world. We should be doing this. One of the main issues, and it's playing it now, and we are seeing it now, is that for many years, the food system has left small farmers, small producers, workers left behind. There has been no support, no rights for many of them, while we are seeing how big and really big companies are taking the biggest part of the value chain, of the final price. Actually, we are saying in the same report how from January, so just in these 6 months of pandemic, the biggest aid food and supermarket companies have shared with their shareholders $18 billion. That's really huge and shows that disparity on where the money is going, but who is really feeding, finally, who is closer to the communities, who brings the diversity of foods, who can ensure the food security in local markets are those that everyone is leaving behind. This should change the other way around.
And Reem, if we bring it back more to sort of a more local, even national level, when governments are trying to balance protecting lives and livelihoods, clearly in some countries it's not happening, it's not working well. How can they better approach this?
Well, we are providing assistance. We have been providing technical assistance to governments to be able to overcome production issues. And as you've mentioned just now, that domestic production and food production is a real problem in many countries, especially the poorer countries in Southeast Asia, in Africa, where they are also struggling with the effects of climate change. So smallholder farmers, they're not seeing the same amount of rain they have seen. We are seeing this year, we've been seeing this since December, for example, the rainy season in Africa is not the same. And the rainfall is a trickle, really, compared to what it should be. So at this point, the real work that the World Food Programme had been doing was supporting smallholder farmers, helping them find markets, helping them consolidate their scattered land, and being able to spend less and get a lot more from their small patches of land. But of course, with the global pandemic, this is something that nobody would have been ready to tackle. And if you're in a weak position, if you're struggling, if you're poor, if you're a smallholder farmer, what can you do in the face of such a hurricane, if you will? So first of all, we need to get out of this bottleneck that we are in at the moment. And the most important thing is actually providing food for people, and then working on the solutions, which we have been working on. Is a regression. Of course, there is a regression that's happened.
Walid, I'm just going to ask one last question to you, because the report did highlight women as being particularly hard hit by this hunger crisis. And I was wondering, is that the case in Yemen, and why?
Well, actually, the answer would be yes. As most of households were held by women, and most of the domestics and households are held here in Yemen, are all dependent on women, especially at home. Many of women are concerned of their children, are the first caretakers of their siblings and their children. So they are we can consider them as in the front line, defining and affecting by the armed conflicts here in Yemen, just like or more than men who were going to the front line and to the armed areas. Here in Yemen, we have especially 4 governorates that affect more on women, which are Hodeidah, Al-Hamahwit, Taiz, and Sana'a City, which hold a lot of families and IDPs, which exceed until now 4 million from these special 4 governorates.
Okay, Walid, I'm afraid we have run out of time there. Many thanks to all of our guests for joining us today, Chemavera Walid Al-Thujiri and Reem Nada. And many thanks to you too for watching. You can see the programme again anytime just by visiting our website, that's aljazeera.com. And for further discussion, do go to our Facebook page, that's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Laura Kyle, and the whole team here, It's bye for now.